There's no need to be perfect to inspire others. Let others get inspired by how you deal with your imperfection. It's your girl Olori, and I'm here once again with Dr. Ade Sawyer, a renowned gynecologist, an obstetrician, a promoter of good living and perfect health.
Thank you very much, Olurigiwa. Thank you for having me. Thank you for finding worthy of your various questions.
You're
It's
welcome.
always our pleasure.
You're welcome. Dr. Ade Sawyer,
Ma'am.
did you add on?
No, I'm very, very active in the gym. I'm very active at the pool. So I do a lot of exercise. I'm not maybe my outfit.
Means you're looking very healthy. That's what I'm trying to say. You're looking very healthy.
Thank you very much. I preach what I do. I do what I preach.
Right. Okay, so you're in the hot seat today.
Let it come.
That seat,
Let it flow. Let it flow. Let it flow.
Okay, so Papa for the women. We have questions for the women
Let's go.
today.
Let's go. Let's go.
So today we'll be talking about reasons why some women struggle to get pregnant, or factors why some women struggle to get pregnant. Dr. Desanya, do you believe some women struggle to get pregnant?
Yeah, absolutely. That's a topic that borders on fertility, infertility, or subfertility, as the case may be. There is no doubt. I mean, it's a well-known fact that some people struggle to get pregnant.
Okay, so I have here some of the factors that I think may cause some of these issues, or as to why women struggle. And so I just want you to, analyze and expatiate for the audience.
Okay.
Okay, so number one, I think, or could age be a factor? And when
So,
I say age, can you differentiate? Can you give us the age range,
okay.
fertility window, and all of that?
So first and foremost, infertility is inability of a couple to achieve conception, to achieve pregnancy after regular unprotected sex for at least a year. So it only means that there are various factors that come to play to ensure someone is get getting pregnant. So if someone is not achieving that, there are there are various factors
Okay.
causing it. Now, factors causing infertility or subfertility, age is a well-established factor for various reasons. Now, age, there is what we call reproductive age group. The reproductive age group, if I put it this way, from puberty till menopause, that's age where you can actually reproduce.
Okay.
Now, does that mean that okay, if you are you attain puberty by 10, then by the time you become menopausal, maybe 55 or 50 or
Okay.
56, can you still get pregnant at 55? Can you still get pregnant at 60?
Mm-hmm.
So the question is, when is the best time, the most viable time for a woman to get pregnant?
Right.
If you want fact, it's usually sometimes between 20, 21, 22, you know, 20 to the late 20s. Some will tell you,
Mm.
okay, 20 to 20, to 35. The 35 is because after the age of 35, there is a question about the quality of egg that your
Mm.
body produces.
Mm.
So it does not mean you can't get pregnant. But what is the quality of egg that is being produced? Does that have an effect on your chances of getting pregnant? So age is an established factor when it comes to uh, fertility. Let me also look at it. Let's look at it from this perspective. Our environment. Have you asked yourself
Mm.
why, when you are in university, when all these teenagers
Mm.
just having fun, from their being from their being adventurous,
Mm-hmm.
especially sexually, They just have fun once in 2 months and they get pregnant. And the same person, when you are now married, you are not having sex regularly, yet you are not getting pregnant. So there is a window, utmost fertility. Like, okay, you are best at your best.
Utmost ripeness.
And it differs from one person to the other, though. So there is a society factor that makes one wants to say, okay, I'm not getting married until I'm 40. I'm not getting married until I'm 35. If you remember in the olden days, most of our mothers, once they're 20, 21, 22, it's either you have 1 or 2, 3 kids already. But now, if you are 21, 20, 22, is either you're still looking for admission,
right,
or
you're still in university.
You're still in university. And this is a person that will finish first degree.
Want to do second degree, masters,
masters, PhD. Then after PhD, you want to ensure that I'm financially stable. I want to pursue my career. So before you're settling down to, you're already 35, 40.
What do you call risky?
That now is a period where you actually struggle. Not because you are genetically incapacitated, but because you have missed the window when you are at your peak in terms of fertility. So age has a lot. There are other deeper explanation why age is a factor. For instance, at birth, every girl child has a fixed number of ova in the ovaries that you come with. And this ova, there's a lot of work. There's a lot of, they come out every cycle. That's what's responsible for your monthly period. They come out and a certain number trying to, come out to get fertilized for pregnancy to take place. There is a few number that will become atretic. There is one that will be released. Then the fate now depends on what stage are you, how ready are you, what are you doing? Is it going to be fertilized and become pregnancy or not? So now, as you age, it means the fixed number gets depleted. There is a drop in the number of the follicle that is in your ovary. So you can see how age is contributing. So when you use a lot of follicle and you're now 40, 35, 32, 33, 30. I'm using those age because that's the age we commonly get married,
right,
in our environment. So you cannot compare the quality of egg. A 22, 23 is producing with that. That is, in terms of quality, in terms of number, there is a huge difference. So that is as another way to look at how age affects people struggling to get pregnant.
Okay. Dr. Desonya, I know some women struggle to get pregnant because they have fibroid. Is that also a factor?
Well,
or can that also be a contributing factor?
Absolutely. But you must note something. Fibroid is a benign tumor of the womb. It has a casual relationship with fertility, ability to conceive or carry pregnancy to term, fecundability as the case may be. But to tag fibroid as a cause of infertility is not
right.
Why? Because there are quite a number of women with fibroid, irrespective of the size, that can still carry pregnancy to term and have a healthy child, to a healthy mother. But there can be challenges when fibroids are located in certain area where it disturbs the activities of the gametes, like, okay, the sperm from getting to where the ovary is, where it gets in touch with the ova to fertilize it. So there are various ways it affects fertility. it can increase the size if its fibroid is big, because you know that, okay, for a woman to get pregnant, there is the womb, there is the fallopian tube that connects the outside with the ovary where the egg is released from.
Mm.
So anything that disturbs that path can disturb pregnancy. The same way that if you don't have sex, if you don't produce that sperm and put it in the vagina,
Right.
nothing is going there to go and to go and fertilize the ova. The same way that when you produce and release it there, if there is cervical problem, stenosis, adhesion, there is no space for the sperm to go. And so the same way, if you have huge fibroid sitting down in the womb, either at the entrance of the cervix or of the womb, or at the outlet into the tube to go to the ovary, it can prevent pregnancy. But it's not all fibroid that will cause infertility. Then you can have a patient with small fibroid, very tiny, and they will be struggling to get pregnant. And you see a woman with huge fibroid, and they will have a pregnancy, carry to term, they will have the child. So fibroid is a factor, but it's just it has a contribution when it comes to infertility, but it's not a cause of infertility.
Okay. So, Dr. Lisa, I have a little concern. How do we explain unexplained infertility?
Okay, that's a very beautiful question. So now on this, I would like all our mothers, mother-in-law, father-in-law, friends, society, I would like everybody to listen. The idea of young couple getting married February 1st, February 7th, you're already checking the wife's tummy to see if she's pregnant or not, putting pressure on them is unnecessary, and it can be counterproductive. It builds anxiety, which also has a role in infertility. Now, statistics have shown that for young couples, out of 100, there is no problem. Ovary intact, tubes intact, womb fresh, beautiful, sperm 2 billion, everything is fine. Yet, out of 100, just 60 of them will get pregnant. That means in 6 months, just 60% of the young couple will get pregnant. Extend it to 1 month, it improves by just about 75% or 80%. Extend it to 2 years. There is this 10% that will still be struggling to get pregnant, not necessarily because there are obvious or major health issues, but because per cycle, the chances of conception is a probability, and it is per cycle. So it's just about 30%. Even when everything is fine, it's 30%. So although there is a lot of studies ongoing, deeper dive into research to know why that particular percentage will still struggle to get pregnant. So there are deeper things where they talk about anti-sperm antibody. Maybe something is killing the sperm before it gets to. No, there are other technical areas that we do not want to. Okay. That is why there are a lot of advancement in area of technology to bypass some of these things when there are challenges along the path. So unexplained infertility, as the case may be, is when you have checked everywhere and you see that, okay, the ovaries is working fine, the tubes are good, the womb is fine, the sperm is in good shape.
Yes, she can get pregnant.
Yes, it's not getting pregnant. So that's what defines unexplained infertility. So there are, in the medical world, there are a lot of solutions available.
How about our lifestyle choices?
Now, lifestyle choices, you cannot overemphasize the importance of doing basic things, which is one of my major campaigns.
Right.
Doing basic things to improve your health, to make sure you are in a state of health that is absolutely solid. We cannot start talking about eating healthy, balanced diet. All of these, they have a role to play. They have we can I can start giving you instances where they are linked together.
Can be overemphasized.
It cannot be overemphasized. But there are also some decisions we make that now bring problem that we problem that self-inflicted. One of it is when you have vaginal discharge as a young lady and you are trivializing it. It's a common practice, that's why I'm bringing that one on. You, rather than seeking help from the professionals, from the experts, you walk to your street, you walk down your street and
Pharmacy.
Pharmacy, drug
sellers.
by the road. Say, I want antibiotics. I'm having that. There are over 1,000 of antibiotics, and there's a funny thing about them. Once you use them, there is a subtle relief you get. You think, okay, everything is over, everything is fine. Then you give room for what we call ascending infection, because if you don't use the appropriate drug, there is what we call alpha clearance. If you don't achieve that, to now clear the remaining minor organisms left in that area, then you give them room, chances to now thrive, proliferate, to multiply, and they start going up to disturb those friable tissue. And once you disturb them, then that kind of person will start struggling with conception. That is lifestyle.
Yeah.
There are other things: don't smoke, don't drink, or minimal, be modest, all of this. When we say all of these things, a lot of people think, oh, don't mind them, don't mind those doctors. In fact, some have pointed at me that I know one doctor that smokes, he's a chain smoker. I know one. It doesn't make it right. So all the do's, don'ts, I think we should stop trivializing them. Don't assume that doctors are just, or scientists or experts are just make some intentional effort to follow the rule, those basic things, build your system, build your immunity. All these things have a way of working together. Let me also tell you that the stress in the society also can be very, very disturbing.
The stress
level, so much so that it can also disturb
contributing factor.
Fertility, even mood swing, mood changes, anxiety, stress. There is a way they disturb the higher center where the major control of your hormonal, a lot of hormonal imbalance, a lot of on the social media, you say, hormonal imbalance is not a diagnosis. The hormone is not always perfectly balanced at every point in time. It changes per time. So when you say hormonal, some people will just go, I want to check my hormone. What are you checking? Okay, when you see, what are you even doing about what you are saying? So the most important thing is there are a lot of factors that switch, even drugs at times that switch all these things. So stress level is significant. The reason why I was talking to our mother-in-law, by the time you start checking on your wife, your daughter-in-law, you're putting pressure on them. They are they're calculating. They are putting pressure on the husband. There are ways that all these things also affect ovulation, even performance in terms of sexual need, erectile dysfunction in men. A lot of stress hormones that are released in your body. These things are counterproductive. So everybody should just calm down. Everybody should take it slow.
He said, "Hello, Okay, Dr. Adesanya, thank you very much for the clarification. Okay, so I think before we round up, I think I also have something lingering in my head. Do you think birth control could also be a factor? Birth control.
Birth control. Pills or birth control generally?
I mean, birth control generally.
So
the
generally,
pills,
when
the
you talk
IUCD,
about birth control, you are talking about contraceptives.
Yes, contraceptives.
Now, what contraceptive does is to give you absolute control on your system, on your fertility.
Okay.
You are empowered to determine when you want to get pregnant and when you decide to take care of pregnancy. So now that may not necessarily contribute to you struggling to get pregnant.
Okay.
I know there is this erroneous belief, misconception about, okay, for he to be able to disturb you from or stop you from getting pregnant, that means if you are not ready to get pregnant, it may not allow you to get pregnant.
Yes.
It's erroneous.
Are you saying it's not true?
It's not true. Now,
Okay.
if you are very observant, and you have someone that has been on bell pill before, there's what we call typical use and there's what we call ideal use of all some of this. Let me take, for example, the combined oral contraceptive. I'm telling you now, even if you have been having sex regularly before, you are struggling to conceive, and you are started on combined oral contraceptive pill, and you use it for a certain number of periods. If you miss your pill and you have unprotected sex, you get pregnant. So if you miss your pill, that's why you must be you must pay extra attention and be very religious about it. So, however, there are some, like I said, lifestyle that may, like for instance, let me take IUCD for instance. We're talking about vaginal discharge the other time. IUCD is like a foreign body, and you're putting in it there. So one of the mechanism of action is also, as a foreign body, it does some things around the womb and prevent the and prevent the sperm and even the ova from settling. You know, that's the best way I can explain it for our audience. So it has also the ability to increase your vaginal discharge, at least for the first 3 months. Now, if you are the type that is not very hygienic or that you don't handle your hygiene very well, it will predispose you to having infection. Now, you remember all the things we talked about vaginal infection, how it can also disturb fertility if not properly managed. You see that it's not actually the IUCD causing it. It's the way you handle it and your hygiene
around it.
And even when you have the infection, what did you even still do?
How did you take care of it?
How did you take care of it? So those are the things that will not lead to. So not the IUCD. Right. There is also this injectable that, there are injectables that you take for 3 months. There is this statement that it delays the resumption of fertility.
I was going to say that. I was coming to that.
So now, if you are taking injection for 3 months, the duration of action, maybe 3 months. If you are taking in January, you cannot by February or March start saying you want to get pregnant, because the drug must work and complete its work.
Right.
So there is also a window period.
That's a misconception,
after. So what you do is, if you are an injectable and it's every 3 months, just go off the injectables early enough when you're planning to
get pregnant.
When you have set your. Yes, there is a fact about the fact that it can delay resumption, but it doesn't take it away from you completely. That's for the injectables. So, broadly speaking, contraceptives or birth control does not cause infertility and does not disturb your fertility.
Okay. All right. Thank you very much, Dr. Adesanya, for the clarification.
My pleasure.
There you have it, guys. If you're still in doubt, if you're still confused, if you still have questions, kindly drop your comments. Kindly drop whatever you have to say, whatever is on your heart. Ask him questions. Drop some comments. Tag a friend. Tag some friends. And the address is on the screen right now. Thank you very much. It's your girl, Olori. Stay safe.
Thank you very much. Thank you for listening.